Hi, we're here with Dr. Carlos Porter in San Antonio, Texas. And Dr. Porter, you've had kind of a reputation for a lot of years as being a healer. Um, I've lived in the same city as you have for a bunch of years, and I've heard some talk from patients of yours that you really invest yourself into healing. And then plus you've done some research on anti-aging and the actual mechanical steps in the cells as far as healing.
Yes, as far as the anti-aging, it's a very interesting topic, a very important topic as we get older, especially that we're having a generation where it's predicted we're going to have more 80-year-olds in the next decade than we've ever had in the history of civilized nations. So it's going to be quite interesting to see that happen, but I really appreciate that.
Yeah, it's true. You've got a good reputation as someone who is kind of cutting edge, always staying forward thinking, and always trying to put your patients first. But the reason that we're here talking to you today is it just so happens that you were the very first person that Dr. Farnsworth mentioned to that he wanted to get thermal imaging into a cell phone. Do you remember that meeting at all in 2012?
Yes, we've had several meetings in the past where I talked to Dr. Farnsworth, and we particularly had breakfast that one morning of some of the different projects he was working on. I remember him telling me about the thermal imaging project he was working on, which I found really quite interesting, especially if you could get it to work. So I was hopeful, but that was quite some time ago, and I understand now it may actually be a reality.
Yep. So rumor has it that he left that meeting with you that day and went ahead and started filing for a patent on it that day. But he was a little concerned that he may not be the first to the market with thermal imaging in the cell phone, and so he started down a process of building an app that would help govern any phone that had thermal imaging in it to help point at the breast and help spot breast cancer. Are you familiar at all with any of the endeavors that he had going along that way?
Right, well, I know Dr. Farnsworth is a very industrious person, and knowing that he was adamant about getting this done and trying to file the patent right away, I think that's kudos to him. If the fact that he maybe wasn't first to market on that, going back to the drawing board and not giving up and developing an app that could mate and interface with that actual technology would be the next best step, especially with the prevalence of cell phone technology and the privacy that it allows you.
You've had a lot of patients over the years. Have you lost any women to breast cancer, either in your family or patients?
As far as my patient panel with breast cancer, unfortunately, knock on wood, I've been very, very lucky from that respect and haven't had that much of an issue. With the screening processes nowadays, we're pretty adamant in my practice to make sure people get screened. You know, this would certainly be another tool in our armament to get that done, especially people that are a little more apprehensive, or some of the people that may fall between the cracks, that there's certainly some gaps in when to start screening.
So, do you think, based on what you've heard, that it's possible that the app would actually work, that it's legitimate, that it would spot breast cancers early using a thermal imaging camera out of a cell phone?
Well, I think, as I said before, thermal imaging cameras trying to spot cancer at an early stage is very, very important. I think if the app does work, there's some good trials with it, I think it's something we should be looking at using almost universally.
And what's your opinion of breast cancer? Is it being neutralized early, or is it on the rise? Are you seeing a younger age to it at all, or is the status, is it working? Is the medical model working for?
I think as far as the medical model and current management of breast cancer, I would say it's adequate. You know, certainly there's always room for improvement. I think the thermal imaging of the breast, self-monitoring at home with something that's this advanced in technology certainly adds to all our efforts, and especially if it's something as harmless and non-invasive as a thermal imaging from a simple cell phone in the privacy of your own home. That's something that I think is almost a not even thought process to do. We should do it.
Yeah, that's great to hear you say that. Do you think, with it being as easy as it is, do you think women would do it? Would they, in the privacy of their home, would they take the initiative? I know that a lot of women just kind of hope that breast cancer will go away. They don't really want to find out they've got it. They're too scared of the process that would follow once they know that they have it. Do you think women would, in the privacy of their own home, point their cell phone at their breast if they had thermal imaging and be curious enough to start the process?
I think as far as home self-screening and the ability or the desire to screen at home would certainly be something much more approachable, much more accessible for somebody to do it in the setting of their home, when they want to do it, how they want to do it. No appointments necessary, no scheduling of time. Do it whenever you have time. Getting ready in the morning, on the weekend when you're not doing a whole bunch maybe. Sure.
Yeah. Well, that's good. Also, I meant to tell you before, I didn't, but right over your left shoulder is UTSA University. June 18th of this year, they came out with a new cancer treatment. It has to do with the injecting of nitrobenzene aldehyde into cancerous masses, and nitrobenzene aldehyde desires to be an acid, but it's not really an acid until they run a light over it, and then it becomes acid. And cancers are mostly alkaline, right in the center, and then they're surrounded by acid, but they don't survive very well in an acid environment at all. They inject the solution in the breast, then they run the light over it, the light turns it into an acid, and within 2.5 hours, the 95% of the cancer is gone. And as you know, and as I know, nitrous benzene aldehyde is not a very expensive process, and if a person could spot it with a thermal imaging in a cell phone, do you think it would be possible that doctors like yourself, kind of worldwide, would be able to catch on to that concept, be able to inject the breast themselves, not necessarily have to rely on oncologists as time goes on? Do you see that? I know this is a brand new idea to you. Do you see that as a possibility, that it would be something at least that you might want to look into, the ability to inject that into any breast cancers that you might spot?
Well, certainly as a modality of treatment, there's always good to have other options, especially self-limiting, more simple type options that are very cost effective. As a graduate here of the Health Science Center, UT Health Science Center San Antonio, I'm proud that my whole school has actually come up with something like that. They've come up with a lot of things, and that's just another feather in their cap. Going back to the screening process and the treatment, not only looking at our country but worldwide, I think if there's a very cost-effective treatment for a problem like this pervasive, I don't see why we shouldn't be doing it. You know, we do have a very high specialty-driven model here in the United States, which is a very expensive model. So anything to turn the tides of that to affect cost savings and also affect treatment options certainly would be looked at.